public health physicians in Nigeria have joined the campaign to end gender-based violence in Nigeria, and this decision was taken at the 37th Annual General Meeting of the Association, where the Vice-Chancellor of the University of Medical Sciences called for responders of gender violence to also be given the status of essential workers.
It is the plenary session of the 37th Annual General Meeting and Scientific Conference of Association of Public Health Physicians of Nigeria. Spotlight Initiative is also using the occasion to flag off Orange the World campaign for doctors in the country. This is because of the important roles doctors play as responders to survivors of gender violence.
I call on you to join our efforts in addressing the root causes of gender-based violence within our society.
The role of healthcare professionals is germane, and I want to passionately appeal to you all to support us in the crusade to expose perpetrators of these evil acts.
The goal of the meeting is drawn from the theme, strengthening Nigeria's health system to meet the needs of survivors of gender-based violence and harmful practices, lessons from the COVID-19 pandemic. During the lockdown initiated by the pandemic, only essential workers were allowed movement. Responders and carers of GBV survivors were not allowed movement, and this further aggravated incidents of GBV in the country. Doctors have pushed for policies to address these situations.
Development of policies and programs, and not only development but also evaluating those policies so we can know what works and what does not work. Gender-based violence at all, either directly or indirectly, and it benefits no one. It's time to end gender violence in Nigeria.
I'll speak to you about this.
The wife of the vice president is worried about the emotional trauma gender-based violence causes and believes there is need to give responders the status of essential workers.
Things, the holistic ways that we assist and give therapy to those that are survivors of gender-based violence, giving me the tools to use to let everyone know that those that are not medical personnel are just as needed, so that we can walk step by step with them until they are through the trauma.
As much as emphasis is put on strengthening health response, prevention of GBV is equally important and needs to be intensified through behavioral and social norm change.